Hello, and welcome to today's webinar, How Mobile Technology Can Help Healthcare Organizations and Health Systems Ease Panic Challenges and Restore Consumer Confidence. I'm Carol Flagg of Answers Media Network and Healthcare Now Radio. Thanks for joining us today. On this webinar, we bring two longtime industry leaders to the table to explore how mobile technology can play a crucial role in encouraging patients to return to their providers to reduce cancellation rates and, in return, keep critical revenue flowing. And now I'll introduce our speakers. Luke Popish is the Vice President of Operational Excellence at South Shore Health. He holds a master's degree in business operations and has been immersed in healthcare operations for over a decade. In his role at South Shore Health, he is responsible for designing, developing, and implementing system-wide operations management, and is also involved in strategic development and deployment, leadership coaching and quality, safety, and service improvements in their ED, inpatient units, surgical areas, and ambulatory centers. Joining Luke is Bruce Kennedy, Vice President of Marketing, Public Relations, and Customer Success for MobileSmith Health. With over 2 decades of experience in multiple care delivery environments, Bruce leads the company's expansion of new and existing hospital client and project growth, as well as oversees client success operations and client application utilization. Prior to joining MobileSmith Health, he served as Executive Practice Leader for Relevant Health Group and led the marketing operations at Duke Health for over a decade. He has also consulted with Essentia, WebMD, Everyday Health, and has participated in initiatives advancing global patient safety, clinical quality, and combating healthcare disparities. On this webinar today, Luke and Bruce will look at what they've learned so far as the industry continues to deal with COVID, the use of mobile apps to position you for a brighter future quickly and safely, preparing for the next crisis and differentiating your organization from others, securing buy-in of mobile technology, and finally, we'll end with some time for Q&A. Also, a copy of the slide deck and recording will be sent out within 48 hours of this event. And now I'm going to turn this presentation over to Luke and to Bruce.
Thank you so much, Carol. We are so happy to be here this afternoon, and maybe some parts of the world this morning, to talk about how we collectively can and have eased challenges for hospitals and healthcare providers during this pandemic and beyond. Before I jump into who and what we are, I just want to thank everyone for attending, especially Luke, my buddy Luke over at South Shore. Over 95% of our clients are hospitals, and most of our team come from hospitals. And so we're very, very sympathetic and empathetic to what's going on in hospitals from an operational and human perspective right now. So our hearts and our prayers go out to all participants during this webinar, and registrants and attendees who are themselves dealing with some of the challenges at their own hospitals, both professionally and personally. You're the first responders, and so thank you for taking the time to be with us today. We were founded in 2013, and we've worked with over 200 plus hospitals in terms of providing mobile application support that it always looks to bring together providers, data, and patients to improve the overall care journey, right? We're part of that care journey. Our vehicle happens to be mobile application development as the glue that holds that together. And so as we work with hospitals over the last 8 to 10 years, our goal has always been, how do we improve that care journey by better supporting both the patient, the provider, and the hospital as part of that care delivery team. Next slide. What I wanted to start out with, just to set a bit of context this afternoon, is a wonderful read that we picked up. I actually had the opportunity to interview one of the authors of the book you see here, Healthcare Digital Transformation. I interviewed Pat Manalban about a week and a half ago, which you could actually hear that interview on our Health Aptitude podcast, brought to you by by Answers Media. So please check it out. Great read, very context setting. And one of the things that I noted about this book is that it looked at digital transformation, and I think in a very realistic way for healthcare organizations. And I pulled a few bullets out from the book because I think it sets the context for our conversation today. I think everyone knows this, but for the most part, if you work in hospitals, you know this very well, that it's not the technology that holds healthcare back, but it's culture. And it's not a bad thing. In many ways, it's a good thing that's focused on safety, right, and driving less adverse incidents and driving quality of care. But there is a technology barrier there that most hospitals are looking to overcome. Patty, who I interviewed, the co-author, had said that most hospitals, the health systems they worked with, did not have an enterprise digital platform strategy. It's not surprising necessarily. And that organizational readiness determines the pace of transformation. So this is that threshold question. Are you ready to move forward? The technology exists, but are you in a position to move forward? And if you are, what position are you in? Patty and Ed defined 4 maturation levels for those who haven't read the book that I want to talk to a little bit in a moment. But one of the things that was most interesting about this book when I spoke to Patty was that toward the end of developing this read, COVID hit and they delayed a bit, and then they reproduced some of the passages in the book and some of the chapters in the book to reflect the fact that we were in the middle of a pandemic, and that's what I found most interesting. That they had kind of gone pretty far with the book, and then had to kind of look and reposition it a bit to include the pandemic response. And one of their findings chiefly was that COVID acted as an accelerant to digital transformation. So no matter where you were when COVID hit, those plans you had on the table, those plans you had in design or at lower levels of implementation, became accelerated. And so that's why the book, from my perspective, was so prescient, along with being able to talk with Patty about the book. So I wanted to set that as a backdrop context as we move into this conversation around how do we ease some of these challenges during the pandemic, because this book is on point when it comes to that. Next slide. So Patty and I talked about, and this is in the book, the 4 maturation level model. And this isn't very much in line with how we think about a hospital's or healthcare organization's mobile roadmap, right? Not every hospital is in the same space at the same time. Not everybody has the same resources to move through the various maturation levels. But the book defines 4 levels, and that's pretty much in line with how we look at the world. So when we see a hospital that we are looking to work with, or we want to help support, for model 1, you're looking at EHR capabilities, right? I've just got my EHR on board, and I am running through the capabilities of that EHR system that we just put so much time and money into. That's the first level. The second level is, okay, what digital initiatives can we focus on, and how do we look at the virtualization of care? So let's extend beyond our EHR as the platform into how are we virtualizing, how are we remote basing our care platform? The third being standalone digital initiatives. Are we being responsive to the internal demand that we're seeing, right? Are we now reactive from a planning perspective? Because we put out there now has been kind of the base strategy. So can we now begin to almost, in a sense, take requests in terms of ROI modeling, performance service modeling, care redesign modeling? Are we at that point? And then the fourth is, have you developed a long-term strategy around digital transformation that takes you from where you are through these maturation levels and beyond? And I think it's important to understand, when I talked with Patty about this a couple of weeks ago, my question was, well, can you stay at any of these levels for any bit of time and still be successful? And he was like, absolutely, because your success is based upon your resources, right? To a certain degree, you can't out-success your current resources. So you are your own hospital, and you move through your levels of transformation at your own pace. And I thought that was important to note. Next slide. So the question always comes down to what challenges are we facing? I won't blather through all the challenges that you faced during COVID, because essentially the same challenges you faced before COVID, everything is just accelerated. Everything is just intensified because you're being pulled out of your normal operational set, right? So if you're having inadequate preparation issues with your patients prior to COVID, failure to show rates, your campus is confusing and patients were getting lost, a low level of health and procedure literacy prior to coming into the hospital. If you're having challenges with care coordination or preventable readmissions, chances are all of those things have spiked during COVID, just like your COVID hospitalizations, right? So what you see prior to COVID as challenges are no doubt, I take that back. Perhaps the thing that is less challenging is now is you're probably seeing a different cohort coming into your ED, right? And that in itself is a problem, but that's probably you're probably seeing less or have seen less heart and stroke come into your ED, and perhaps because of some of the levels of sequestration and some of the curfews that were put on earlier in your areas of the country or cities or towns, you probably saw less trauma, right? So you probably had less trauma-based ED volume coming in at one time, but even now that's changing as cities have opened back up again. But challenges are challenges; they've just been exacerbated to the point that Patty and Ed make in their book. Next slide. So what are we looking to address on the mobile technology side, right? So we have all this technology, we have all the platforms that you'd ever need to grow and develop technology from, and we have a lot of insight, right? But a pandemic hits, and so what are we really focused on at this point, right? So we've determined there are three things that come into stark focus during a pandemic, and they're areas where mobile technology and application development can certainly help. The first being easing patient and staff concerns. This is by far one of the biggest challenges faced by hospitals in terms of the pandemic. It is, how do we go about making sure that we've created the right environment for our patients to exist in safely, comfortably, with certain levels of security? And have we done the same thing for our staff? And have we addressed our staff concerns through this pandemic? I think I mentioned this earlier, but there was a precipitous drop in the amount of heart and stroke volume coming into EDs, at least early on during the pandemic when we were really looking at this very, very closely. This is non-COVID related ED. So your heart patients that were normally coming in, your stroke patients that were coming in, basically dropped to nil in some of the hospitals we've spoken to. Nationally, that number was a 40% drop off into your ED. Sensing that or noting that patients just did not feel comfortable coming into the ED. And to a certain extent, hospitals were challenged by either creating a safe space for patients and communicating that, and helping patients wayfind their way or navigate their way to those spaces and feel safe doing so. So for patients, what you want to be able to do during this pandemic or any pandemic is increase the amount of real-time information and push notification updates on hospital status and navigation changes. Mobile is in a unique position to be able to do that. You can't do that through a website, really. And the ability to have a mobile app that is pushing constantly on changes that are happening at your hospital is vital during this time, and vital to making folks feel as though they can be safe in your ambulatory or non-ambulatory environments. In terms of staff, securing communication internally, especially when you're bringing in, large numbers of visiting nurses, or you're recruiting doctors in that may not have worked with you, for a few years, or that work with you at all, or you're pulling people out of their normal roles within your hospital or health system. It's important to have that basis for staff communication and secure communication, so that you don't have pockets of your staff going out to, let's say, social media environments, even though some of those are secure. So going out to Facebook groups to be able to communicate with each other about what's going on. You want to be able to have a secure pipeline into your staff always, and allow them the opportunity to talk with each other internally in a mobile device, because in many cases, you've not always given them access to all of the computer systems to be able to do this internally. So easing those patient and staff concerns are important. Symptom attestation tracking. This obviously has become big both in the hospital space and non-hospital space, or care and non-care space. Any employer right now that's looking to bring staff back over a period of time should be using an attestation app if it fits their particular business model. But the ability to collect daily symptom information based upon department, location, role of your employees or staff is vital to being able to properly mitigate and to a certain level of contact trace along with that mitigation, and to know when to be able to start the case management process with those staffers based upon some level of symptomatology. You also want to be able to have that as a secure pipeline of information to your HR teams and your occ health teams, so that they can begin to start that case management process and be able to mitigate the virus running through your workforce. So there are a number of companies and hospitals that are trying to do this in a manual approach, along with taking temperatures. There are better ways to do that through a mobile app, and that's how we would support the symptom attestation tracking objective. The third and probably most important of these three, or as important as these three, would be improving encounter efficiency, right? So as I mentioned earlier, you've already had a situation where every problem that you've found you're currently facing has been exacerbated because of COVID. So now is the time to be able to develop applications, utilize mobile applications to better connect your patients with your doctors, with your EMR. And that's where mobile has a unique role. Mobile has the ability to bring all those things together so that you now have a situation where you can better track patients as they're moving through your system, whether it's on the clinical management side, on the surgical management side, both pre and post their encounter with you. You're also looking to, in a very real way, decrease any non-opportunistic patient contact, right? Whether it's planned or episodic, are there ways that you can begin to decrease the level of contact you have to have with that patient? And this goes beyond telemarketing. Telemarketing still requires a body to a body. We're talking about how are you able to track a patient through their medical adherence cycle, right? Are they adhering to the treatment plan? Are they doing the things that you require them to do or recommended that they do? And as they go through that process, you can then see it within your EMR, your environment, to know when to intervene and when to start that recovery process. So those are three important areas where we've seen benefit in the ability for mobile apps to provide a level of support both to the patient and to the healthcare provider. Next slide. So what does this look like in our ecosystem? And whether you're a provider, a patient, a payer, whether you're an employer who's providing a level of self-insurance to you're self-insuring your employees, you're still within this circle of life when it comes to data, EMR being the data in the middle. And this is an interplay between providers and payers and patients that we're all very much aware of. The idea is, how are we driving care improvement, care optimization, patient adherence? Very important. Are we looking closely enough and impacting patient-provider satisfaction? Are we containing costs? Are we being efficient, right? Are we making every encounter count? Are we pulling in the intelligence we need to make us smarter so that we can then care for patients better? And also, are we maintaining a level of network integrity, all right? Are our handoffs clean and pure? Are we able to instruct patients to the right level of care when they need it to maintain that level of network integrity? Luke is going to run through some of our mobile health connect apps and how they're using them within the South Shore Health environment. We do have other applications that support the challenges you're facing during a pandemic. We have our COVID Clear COVID Response series, which is an attestation app that some of you may be using, which is built around the idea of better alerts, better mitigation. We also have a platform that's devoted to patient adherence and care improvement. Our PeriOp and condition management applications are focused on bridging the gap between the patient, the provider, and the EMR, and allows hospitals to better track, or providers in hospitals to better track what's going on with their patients so that they can see how a patient is improving post-care, how a patient is getting ready for their procedure or appointment prior to that encounter happening. They're integrated obviously into an EMR environment. At this point, Epic and Cerner are partners of ours in this particular project, and we have a pretty close relationship with AT&T Business in integrating some of these applications into hospitals' environment. Next slide. So I'll cover quickly two apps that are responsive to specifically to COVID. The first is something I mentioned earlier, which is COVID Response. That's focused on helping staff internally communicate with each other so that you're able to get comm updates from incident command, provides a training environment. It supports nurse and provider communications, live updates, notifications of supplies and materials.
Did we lose Bruce?
We did lose Bruce. Yeah. Luke, is the next slide, I think, yours, right?
If it is, we can definitely hop into it, I'm sure.
Yeah, that's what I was thinking. All right.
Well, that was quite the transition. Nothing like a cold open. So my name is Luke Popish. I am the Vice President of Operational Excellence at South Shore Health. I'm going to tell you a few stories today of how we leverage mobile integrated technology to advance a few different things on our platform and our offerings. Next slide. So just give you an idea of who we are. A lot of people don't know there's a variety of South Shore Healths if you were to Google it. So we're actually just south of Boston. From the map there, we're about 11 miles outside of the city. But based on the traffic patterns and the way our population kind of is congregated, we have quite a few lives on the South Shore that we take care of. What we find is most of the folks south of Quincy have a tendency to utilize us for most healthcare services rather than travel into the city, because 93 can be a parking lot most days. So if any of you are familiar with the area, the traffic tends to be a huge challenge. So we do have quite a few people that come here. We do over 200,000 ED visits. I'm going to talk to you about some of our stuff in OBGYN. We do about 3,400 deliveries a year. Just to give you an idea of our size, we're a 393 bed facility. So just to let you know kind of a little bit about us. Next slide. Oh, there you go. So we had a 50-bed dedicated maternity platform. I used to be the OB/GYN service line director, which is how I got into the apps and how I got into our relationship with MobileSmith. This was the first app we launched. And to give you an idea of how our OB/GYN platform is structured, we have 4 different practices, 3 of which are independent private practices outside of our health system that do all of their deliveries at our hospital. So we had initially a reason for action around trying to centralize all of the information that was given out to patients and families and expectant moms kind of across the South Shore. And so you can see we cover our service area from Quincy all the way down to Plymouth and some folks on the Cape, if you're familiar with Cape Cod, which is just south of Plymouth. Next slide. So the first thing you might be asking is, you know, do we really need another app? There's all kinds of pregnancy apps out there in the tech space, and obviously many of them have similar offerings or similar information on them. What our answer, or why we said yes, we need another app, was really to attempt to differentiate ourselves in our market. So when I tell you we do 3,400, we do anywhere between 32 to 3,400 deliveries a year. We also, because it's one of the few services where there's still a decent amount of choice for expectant moms, we do have some competition on the South Shore for those moms and for those babies. And therefore, we really wanted to set up something that differentiated ourselves that we could brand. But then also we're going to get into the details behind our other reasons for action around why we felt we needed another app. Next slide. Oh yeah, there's my too many animations in this presentation. I apologize. Next slide. So that's just kind of an overview. You could see pictorially how we appear in the stores. That specifically is obviously the iOS Apple Store. And that's our home landing page there on the right. I'm going to get into kind of all of the information that's contained in this app, and how we reached our patients and families and engaged them in the whole process and the whole experience, prenatal and a little bit even of postnatal. Next slide. So we started this journey way back in January of 2016. We were getting some direct feedback, as you can see from our scores. We participated in Press Ganey HCAHPS, and we really were struggling on our rating of our hospital. We were also struggling with care transitions and helping moms feel supported when they transitioned out of the maternal infant unit and back to home. And the third thing that I don't have a measure for and why it's all red is it was hard to measure the level of complaints or questions that hit social media, specifically the Facebook posts and groups. We have a lot of engaged groups on the South Shore, like Moms of the South Shore, et cetera. And what we saw back in 16 was a lot of confusion, questions about what to expect when moms got to the hospital in labor, what to expect from their labor experience. And then also, some misinformation depending on which practice they went to and who they spoke with at each of those practices. So our solution really was to see if we could put one central repository for all of this information and have it in a place where it could be located easily via phone and help our moms understand what the experience was and prepare them for childbirth and then post childbirth. And next slide, please. So these were some of the comments that we saw. You can click ahead. Yep, that, you know, my old OB. Oh, okay. That, nope. You can go one more. Sorry, I'm not controlling. I'm not controlling the slides. This is just going to get into more of our communication gap. So you can see the Duchess of Sussex there, who would be an ideal patient of ours. She did not deliver at South Shore. I'm not violating any HIPAA rules with with this picture of her. I have no idea where she delivered, but it was not South Shore. But what you can see is essentially she was, if you were Ms. Markle coming in to the organization, you would be getting messages from the hospital on our left, your office on the right, and then again, social media down at the bottom. And the challenge we found is that depending on where she was seeking care at what time, the messages might be garbled, might not make sense, or might be contradictory depending on who you talk to where. So when we talk about why we did this is, I know I'm repeating myself, but something I really want to drive home is we identified a problem. We felt like the root cause was around communication. And then we felt like our solution to that gap would be to engage our expectant moms in a mobile platform. So I think that that's key. And when I tell our story to a variety of audiences, what I try to emphasize is don't start with an app in mind searching for a problem. And so what I mean by that is instead you should really be talking about what your problems are, and does an app provide that best solution or the ideal solution for what you feel like the root cause of the problem is. And I think a lot of organizations get caught up in wanting to have tech, wanting to make sure that they have representation in the apps, you know, in both the Android and iOS stores, and go searching for a problem to fix with an app saying, well, we have this great app, you know, let's see where we can apply it. And I would really encourage you to do the reverse, which is to see, you know, what your gaps are in whatever part of your system that you're trying to address, and then be honest with yourselves and each other about whether or not the app is the best solution. Because I love the MobileSmith team and all of the support they've given us, and I'm proud of the apps that we've done. But I don't know that we would have been successful without having an opportunity to say this is really what can address this problem. And I think we may have failed had we gone in the reverse direction. Next slide. So yeah, these are just these are just kind of like all the messages that you're getting from everybody. So our proposed solution was to create this app, South Shore pregnancy app we call South Shore Babies. So we answered a lot of key questions based on those metrics that I showed you at the beginning. We wanted to answer for patients, what services did we have available? We had a lot of questions about our NICU. What level NICU did we have, if any? For us, we had a level 3 NICU, which is really rare for a community hospital. We're the only community hospital or independent hospital in the state that still operates a level 3 NICU. Most of the other community hospitals will send babies in need to tertiary facilities. So that's important for us when we talk about keeping our moms in our area and enabling our moms, if they do have a baby that needs to go to the NICU, enables to keep that mom in their, you know, general geographical area and not have to travel all the way into Boston to check on their baby and help take care of their baby. We had a lot of questions about our maternal fetal medicine department and what that was, so we put a lot of information in there on that. We have questions about our midwifery program, so we offer midwifery 24/7. So what exactly do they do? How do I get engaged or involved with the midwives? And then even a postpartum experience. We had some efforts around rooming in and trying to keep our babies with our moms as much as possible. Due to a lot of best practices out there and a lot of evidence, it showed that the babies and moms definitely bonded better when the baby was in the room, and you don't take them to the nursery every day or for most of the day. Baby friendly is kind of a moot point now. We had pursued that for a little while, but that when you talk about customer facing and customer friendly, we had a lot of pushback on that, but we did use the app to kind of explain that and what our goals were around that. So really, from this picture, you can take all of that information. We used to give that out in paper form in a giant packet to every mom on her intake appointment. And what we found is due to the age range of the expectant moms and the advancement of technology, they just didn't really reference or look at those materials. They would be handed them, but then they would end up tossing them out or losing them. And we really wanted to have a place for moms to go regularly throughout their pregnancy to find all of this information. And it also enabled us to put all information in a single source of truth, really, for all of our patients and even our providers, to say, this is when we have changes, when we have operational or process changes, we're going to make sure that we update this because we want to leverage this as our single source of information for all of our community, essentially. Next slide. So where we are today, and obviously this is even a bit dated, I do have updated metrics for you all from January of 20. Care transitions, we made it up to the 72nd percentile. We're in the 67th now, so we're still, based on our current, our previous state of the 45th percentile. That was a huge jump for us. The other one is 82nd percentile for rating in the hospital. We're now at the 85th percentile for recommending the hospital. And that's for our OBGYN department, so specific to maternity. And then we do have a lot of monitoring on social media. And what we've seen in a lot of the moms groups is we've seen a significant reduction in the complaints about experiences here or being surprised by things that they didn't expect. We've seen a lot less search for clarity on the web, on social media, and more search for clarity on the app. We have about half to 3/4 of all of our intakes now adopting the app on a regular basis, which has been fantastic. And we continue to see some successes from that. Next slide. Yeah, there you can go. You can see our average monthly users. Now, again, not completely updated, but when you're talking about 3,400 births a year, to do some really quick and simple math, it's a little under, a little around 300 a month. So when you look at our average monthly users, you can see we go up into the 400s. Obviously, there's some overlap in due dates, et cetera. But that was a really good spot for us, and we feel like we've reached the majority of our population and our community with this app. Next slide. And then the duration percentage for us, we really didn't expect this. I wasn't sure, or we weren't sure how long people were going to use the app and whether or not they were just going to load it when they had their intake appointment and then, delete it or not ever use it again. But when talking with MobileSmith about our analytics and looking at that 1 to 3 and 3 to 10 minute range, kind of that middle, that was really, really positive news for us to tell, to say that people were actually getting into the app and using some of the features we offered rather than the 0 to 10 seconds or the 11 to 30 seconds, which would be suggestive of logging in, maybe checking the size of the baby and then dropping out of the session. So we've seen sustainment of these session durations as well. So for us, what this reflects is that our patients and families and our expectant moms are still using this regularly to get information about either their prenatal or postnatal experience at South Shore or in our health system. Next slide. And again, you can see the graph of our scores over time and as they grew. And I gave you our most recent scores just verbally. If anybody wants any more information on that, definitely reach out to me and I can get you, any data you would like and go further into our story or kind of how we tracked all of this stuff if you're interested. Next slide. So these are just some things we learned, and I think that this is probably what I view as the most valuable part of this talk. If you're looking for guidance, or if you're already in the app development space and just want to know what other people are doing, I think again, internal and external engagement is critical to success. So we really had to take the voice of our customer, which was our expectant moms, read the comments on the website, talk to them when they came into the offices, and find out what exactly they were looking for and what problem we were trying to solve from them. What we found is it was a really seamless uptake for our expectant moms because a lot of them were very facile with mobile technology. We actually had a problem with some of our physicians and clinical support teams at our offices because they really liked that tactile experience of handing over a packet. And so when we moved from this giant packet of information that felt like we were adding value to a small 5x7 card that said, basically directed all of our expectant moms where to download the app, it was actually a little bit more uncomfortable for our physicians and support teams than it was for our patients. So that was interesting. And I think you may find that depending on what service line you're talking about or what, kind of what the maturity of your organization is, it may be a harder sell internally than externally, because what I've found in my years as doing operational excellence is it's really hard to get people to change. I think what Bruce mentioned earlier about the pandemic, and if there's any silver linings in the pandemic, it is that acceleration to the mobile platform or the remote platform. And I think that what I've heard and seen is that those type of barriers have been broken down a lot faster. And I think that a lot of our docs and support staff are definitely more able and willing to adopt some mobile technology because of the pandemic. So again, there's a lot of disasters with the whole situation, but that's one where at least that one's a hashtag bright side for me. And then the implementation and the success in that, it really can help you solve other organizational problems. I'm going to talk about a few others here in a moment where I don't have as much data, but we really leveraged this first app to kind of generate interest in apps in general here. And now we have 3 different apps that we offer in the clinical care space. And now, honestly, we have another app outside of our work with MobileSmith, and I'm trying to figure out how do we get one common solution for everything, because with Epic and MyChart Bedside and all those things, that everybody kind of wants to be in this mobile space, but I think the dynamic nature of the work we do with MobileSmith has been key, where we can change our stuff on the fly. It's very dynamic and very easy to change, and it's not something that's meant to be set in stone and just stand there as a non-dynamic kind of offering where you make up some information, you put it out, and then it just sits. I think one of the keys to our success has been continuing to adjust the app, change the information on it, remove some information that's not used, and engage our patients in that app experience. So the partnership for us was key. I didn't need to be a subject matter expert in app development. When I first reached out to MobileSmith and we kind of started down this path, I almost gave myself a heart attack realizing that I thought I was going to have to design an app from scratch and develop it on my own. And I'm good at many things, jack of all trades, master of none, if you will, but I am not a great app developer. I've tried to learn many times, and I just don't think like a computer sometimes. It drives me nuts. But anyway, and then the turnaround from concept to market is much shorter, I believe, than a homegrown solution. We can go from concept to market in a matter of a month to a few months, as long as we get the information to our partners there, and then they're able to process it and put it into a mobile format. We really don't experience a lot of lag when we have an idea and then want to act on it. So those are really some key lessons that we learned from our experience with babies. Next slide. So we also, after SSH babies started, we then looked into a new program that we had around bariatrics. So that this was, again, what problem were we trying to solve? This one wasn't so much of a problem as it was, let's start a bariatrics program and see where it goes. Next slide. So yeah, we should start a bariatric program. What a great idea. We had one surgeon who was interested in getting this stood up and going. And when I was talking with him, I was like, oh, I should reach out to our team and see if it makes sense to have something for you to engage patients. Because really the initial problem was, or the problem we were trying to solve was, there was no awareness of our bariatric program in our marketplace, and there was no engagement of patients in it because it was new. So again, for some new ideas that you might have, you might find or think that an app is the way to go. And at least in this experience with ours, it was the way to go, and it helped us out quite a bit. And I'll show you that here in the data. Next slide, please. So where we went was, we wanted to create awareness and visibility of the program. Carol, if you can just bump ahead like 4 times. I think, again, I'm sorry, I'm victimizing everybody with animations here. This is normally one that I would do more in person. I also should have told you guys I talk with my hands a lot, and this is driving me crazy because I'm presenting essentially to the ether, and I use a lot of mannerisms when I present. So if I'm putting you to sleep, I'm really sorry. I try to pride myself on being a relatively dynamic speaker, but I too have not fully changed or adjusted to the virtual environment. Anyway, that was a total tangent. But what we want to do is create awareness. We want to engage patients, then prep them who opted for surgery, and then really provide some post-surgical support. So those were really the steps of where we wanted to go with this app. And you can see, what we did kind of in each step and what we provided. Next slide. So information session attendance. That was one of the ones that one of the key performance indicators. And I didn't say this at the beginning, but I think that the other lesson learned is if you're going to try to show value or return on investment, if you're a mid to high level leader at your organization, but you need buy-in from CFO and that type of scenario, I think the key is really to pick some performance indicators that you want to show improvement on by doing an app, and then track those pre and post, because nothing MobileSmith did wrong, or no offense to MobileSmith, but if we had done the babies and we hadn't seen the improvement, we wouldn't have continued to just press on with the app. We would have had to make some adjustments and figure out maybe that wasn't the best solution. But because we had KPIs, we were able to at least know if we were making a difference. And so when we approached bariatrics in this whole new program, we thought, like, what were the best key indicators for us around whether or not patients were engaged and interested in our newly formed bariatric program. And you can see we started back in August of 18, and our information session attendance really went up quite a bit. You can see the registered is quite a bit more than the attended, but I'll take 89 registered and 40 attending, any day over 18 and 6. You know what I mean? And so even though the percentage of attendance might have been down a bit, what we found is that by looking at these numbers, we felt like the app was permeating our community, and we were getting the information out there that we needed to. Next slide. And then our surgical trends by year. This is specific to bariatrics, so we're down a bit in 20, as you can see. That's our fiscal year, so it would have been September through December of 19. But we've had pretty steady trends, and our bariatric program has been relatively successful since its inception. So that's been a good indicator for us as well. Next slide. So again, we talk about duration percentage. This was our third performance indicator, and I really living in that 25 to 30% range in the 1 minute or greater is indicative to us that patients are using the information on the app and not just hopping in and hopping out. So I think that is another one, and that's one that we can track on a daily basis with help from MobileSmith. So that one's been one we focused on really in every app that we've developed. Next slide. And there you can see our surgical cases and our 2020 projections. So each year from the time we started up until now, and again, I wouldn't attribute this all to just having an app, but I think that the emphasis here is that the app was a key tool and an integral tool into helping us grow the program. The 2020 projected may have changed a bit now because of COVID, but we were on a really solid trajectory when we ran this data to, essentially almost double for the past, for each of the first 3 years. Next slide. So where we're going with this again is continued promotion of the program. One of the things that we skipped over a bit when Bruce got disconnected was the Peri software. So we're in the process right now of talking with our pre-op team and talking with our OR staff about getting Peri implemented as well. That'll help us both with the pre-surgical engagement. We also, if any of you are involved in surgery clearances or especially bariatric clearances, there's a lot of pre-work that goes in up front to being able to actually get to a successful surgery day. And one of the challenges we have is making sure that our patients are following up on all of the prep that they need to do, whether it's diet, whether it's blood tests, whether it's other tests, just to confirm that it's safe for them and it makes the most sense. What we'd really like to do is give that a kickstart with Peri and start to engage them even further in that effort. Next slide. And then one more that we've started that we're really proud of. I mentioned our level 3 NICU at the beginning. We have a program called Family Integrated Care. It was developed, I believe, in Canada, and then I think St. Joe's in Denver, just to make sure I give credit where it's due. The idea behind this is that we engage parents in the care of their infants in the NICU while they're being cared for by our neonatal team. And so what that essentially means is that they can actually participate in the rounds of the baby. They can participate in the bathing, the feeding, etc., all while their baby's in the NICU. And what we use our app for in this regard is we actually quiz the parents. They're given a bunch of information, and then they have to do a basic skills quiz before they can qualify to do any one of these things. That would seem like onerous and like a lot, but what we've found is that actually engages our parents in the care of their baby while they're in the NICU, and it makes them much more comfortable caring for the baby when the baby is finally discharged from the NICU. So we've able to, essentially what it is it's some positivity in what can be a very scary time. My third daughter actually spent time in our NICU here at South Shore when she was born. And I really wanted to be participatory and understand what was going on. And I kind of wish we had this stuff back when I was a new dad for her, because it really gives all the information that parents need. And then it can also be used as a teaching tool for the nurses with the parents to show them what to do. And it's been so far, I don't have a lot of data on it yet, but the feedback we've received from parents has been tremendous. And our director of our NICU is really proud of this, and so I wanted to make sure to share that with you. But it really, what I put this in here for more than anything was just to demonstrate how one app in 2016 can be proliferated and really expand into multiple apps once folks see the functionality of what we have to offer. And so that's been really neat to just hear from different people in the organization, like, hey, we're thinking about an app for this. I heard you have some experience in apps. And then be able to talk them through the process, and then figure out, is this something that can be solved with an app, or should be, or maybe that's not right for you, because we have had a few ideas come up that that people were interested in, but when we really went to sketch it out and see how it would work, we were kind of like, well, I don't think that the app is the best solution. So it can go both ways, but it's been very helpful for us. Next slide. Yeah. So again, final thoughts, start with a problem, not a solution. Obvious, it seems obvious, but again, in operational excellence, I have a lot of folks that like to start with solutions, and we have a tough time defining a problem together. So that's probably life lessons more than just app lessons. And then engaging all stakeholders in solution development. So if you decide the app is a solution for you, I present on this, but I did really barely any of the work for any of this stuff other than interfacing with our development team at MobileSmith. Our nurses, our doctors, our nursing assistants, our unit coordinators all gave input into all three of the apps that I just showed you. And they really designed them. And what we did is we made apps based on their request for design for them. And before we launched, when we tested, we had the users test them. And so I think that's a really key point, is to have one person, even if you're a champion in your organization, doing all of the designing and making all of the changes and laying the whole thing out. You may find you have a much bigger barrier to entry or getting these things stood up because you didn't engage or involve those who actually would be using it. Again, it seems like I give a lot of advice that's common sense, but we do miss the mark on that sometimes, and then wonder why nobody's using our app that we spent a ton of money and time on to develop. Next slide. Yep, and then the last thing would be to make sure you track those results. I am on LinkedIn if you need to reach me. There's my email there, and I know that we're going to share the presentation. Give me a call. I'll talk to anybody about our app journey, if you're interested. So reach out at any time. I can tell you about some pitfalls. I can tell you about our experiences with MobileSmith and what worked well. So I'm always here to talk about this stuff. So feel free to reach out.
Yeah, Luke, well, first of all, welcome back, Bruce. And I can tell you, Luke, I'm sure all the attendees, including myself, were chuckling over the transitions, which, my bad, when I reviewed the slides, I actually didn't do the slide deck. I just, did the preview side of it. So I didn't even see the transitions, like, whoa, what's going on? Anyway.
I didn't follow PowerPoint 101. I'm like, I should have included all those before I stepped it over.
Yeah. So, and again, welcome back, Bruce. And so
thank you so much.
We have like 8 or 9 minutes, I think, to take a couple questions. And Bruce, I don't know if you want me to go back into the slide deck, or if you had some additional comments that you wanted to make before we took a couple questions.
Actually, you know what? Not necessary. Luke did a really great job of closing out the portion that I was almost at the end of talking about, which is we have a number of partners like Luke, hospital partners like Luke, who, now that they've built, let's say, a number of service line applications or general hospital applications, they're now looking at, okay, how do I take this to that, let's say, next maturation level or next evolution of what apps can do for us. And I think the way that Luke approaches this and his team approaches this is why we work so well together. Because they don't come to us with a defined app. They come to us with a series of objectives they want to achieve. And that allows us to be able to run with that. And we don't have to run very far. I mean, we are naturally creating app development environments that are roughly 70 to 80% done. And then we're configuring them to meet the objectives that Luke or other clients may have. And that's why I think Luke mentioned that we can get these apps developed rapidly. And that's the reason why, because if you can't develop a mobile app rapidly and deploy it rapidly and modify it and edit it rapidly, then you're not really dealing with mobile, right? Or the need for mobile. And so Luke always asks all the right questions. He does all the right homework before he gets to us. And it then makes it easier for us to help support them to the next level. And Luke's comments about our PeriOp application for patient adherence and patient preparation and patient tracking were spot on. And that's what I was talking about toward the end of my my last, I think, couple of slide decks. So Luke did a great job. Thank you so much. I appreciate it, man.
Yeah, yeah. And Luke, the comment about, start with your gaps first, not with the app, right?
Yes, exactly. Yeah.
Yeah,
No,
yeah.
yeah. Thanks,
Yeah,
Bruce. No
yeah.
problem.
So we're going to take a couple questions with our time left from the attendees. So the attendee says, thanks for the presentation. How about interfacing apps that are used in EMRs and EHRs? How does that work?
So good segue, because we were just talking about the
I know,
PeriOp
right?
app.
Exactly. Well, that's why I asked it first.
Right. So our PeriOp app, it actually is built out of and operates within Epic and Cerner currently. It's built on a Smart on Fire interface, so we're able to pull information into PeriOp with regards to treatment plans, dates of procedures, dates of appointments, and then we can then build a proportional and appropriate pathway of instructions for that patient that they can view on their phone, right? So the information they're getting on their phone is the same information that's in their EMR. We're just adding to it the actual procedural or instructional pathway with all the support materials. So as Luke mentioned, you would assign or prescribe this to your patient prior to their procedure or upcoming series of appointments, and there would be a number of instructions along with all the information you would normally give out via handouts within the app digitally for them to have access to. As they are checking off the things that you've assigned them to do, you then are able to see that on a heads-up dashboard within your EMR. So if you're in Cerner or Epic, respectively, it is built within your environment. As a matter of fact, PeriOp, because we're already validated within Epic and Cerner, PeriOp is also available on your enterprise respective stores. So if you're using Epic or Cerner, you go to your respective store, App Orchard or whatever, you'll be able to see the app available to you as one of the many companion apps for your EMR. We've also, because of the nature of hospitals and the ferocious amount of acquisition activity, you do have a number of health systems where you may not have every HCP or every center on the same EMR. We have a version of PeriOp that can operate without being integrated into the EMR. And so you don't have to be held down by the fact that, hey, you may have some practice providers, surgeons that do not have access to your EMR. We have an environment that can be built for them and just as secure. So hopefully that answers your question about how we interface with EMRs. But I think
Bruce, not to interrupt, Bruce, but you read my mind on that last point, which is one of our biggest challenges right now with Peri is we don't have all of our surgeons as technically part of our system. You know what I mean? And so we're not all on the same medical record, but we really want to push the Epic integration. And so we're kind of at a crossroads now where we want to have all the information in one place, which would be Epic. But then when you talk about engaging all of our potential surgical patients, some of their surgeons aren't on Epic in their community, their community or private practice. And so I'm glad you emphasized that there's a couple different options, because I think EHR integration is great. I think it's where everybody strives to be. But when we look at the kind of the current state of that, it's not necessarily as easy as it seems like it would be.
Yeah. So follow-up question. So the apps are usable regardless of the EHR vendor, and I'm sure asking that just because obviously you're connected with Epic and Cerner, but obviously you can use the apps with any EHR vendor.
Absolutely.
Right. Do you have apps for behavioral health patients to access virtual treatment?
So we treat behavioral health as another service line, the way
Yeah.
it is treated in most care environments, right? So whether it's neuro, ortho, GI, behavioral health, you're still working with a set pathway of instructions that you have between each visit or between each milestone with that behavioral health patient, right? In the case of condition management, let's look at behavioral health as a set of condition management service lines, right? You may not have an upcoming surgery, but you have an upcoming milestone, and there's certain things you want that patient to do prior to your next appointment. So you're prescribing or assigning them an instructional pathway the same way you would assign instructional pathway to a diabetes patient, a hypertensive patient, or any other type of patient. And you can see when they're checking items off. The most important thing, and I know that Luke talked about this a little bit, the most important thing about Peri from our perspective, or PeriOp from our perspective, is whether it's behavioral health or surgical management of a patient, is that it allows you an early warning system, right? To know when that patient has kind of run off the track a bit or is not really adhering to instructions. And then you have that information as a healthcare provider to do one of the most important things that most healthcare providers do on a daily basis. They don't really recognize they do, which is to intervene and start the recovery process, right? That's something that is so granular in most healthcare providers. They don't realize they're doing it every day, but that is part of the entire care delivery process. It's how do you prevent adverse incidences? Well, you can't always, but what you can do is make sure that you have those points where you can intervene and recover quickly. And so all we're doing is we're moving the goalpost a bit so that you can intervene and recover much more quickly and have more information to work up so that you work off of. So you can say, well, listen, here's what I'm calling you. It looks like you haven't done these really 4 important steps prior to coming in for your milestone checkup,
Right.
and that's the power of PeriOp.
Right. As we face a rebound in COVID cases in the fall and also resuming elective procedures, how can apps help overcome patient concerns about their safety, particularly those in higher risk groups, the elderly, people with multiple comorbid conditions, et cetera?
Well, from our perspective, the nice thing about apps is that they can be downloaded and they can be shared, especially the apps that are for us PeriOp focused because they're tapping into the EMR anyway. But if you're an older patient, and most of the patients coming in the hospitals, especially for surgical procedures, are above the age of 60 years old. And so the ability to share this information with a caregiver is really important as well. So I'm older, I may not be as app adept, except maybe for Facebook, for recipes, to seeing my grandkids.
Yeah.
But I can certainly share this information on my app with my grandchild, my son or daughter or a caregiver, and they can help me through that process because they're the ones that are supporting me anyway. But the ability for an app to push out immediate information as notifications to that older individual or that person having concerns about how do I now get to my ER appointment? Is it in the same? Oh, I'm sorry, my ambulatory appointment. Is it in the same place? Do I follow the same procedures? So the ability to help patients navigate and wayfind their way into what for them may be a radically new experience, and just coming in for their primary care checkup is really important. And apps can do that very uniquely.
Right.
Well, yeah, and it offers a single source of truth. I think that our reason for starting the SSH babies was a microcosm of what you just talked about around understanding what to expect when you get here, making sure that people feel safe and making sure they have our good comfort level with our policies and procedures. It enables, if we had a COVID app or, out-facing one for patients, we could put the true information and what's really going on here at our organization, rather than having patients Google and look at multiple news sources, some true, some not, and getting a bunch of mixed messages. They could better understand exactly how we're approaching their safety, making sure that we make them feel safe and secure when they come here, and then having one spot to check all of the changes rather than trying to find that somewhere in the internet space.
Right. Well, Bruce, believe it or not, we're out of time, and I so appreciate you presenting today. It was a fascinating presentation, and I've got people chatting me. Yes, a copy of the slide deck and recording will be sent out to you in the next 48 hours, and
Right.
we definitely appreciate those who took time to attend today. We appreciate it. Thank you again.
Definitely. Thank you.
Thank you.
Thanks all.